philosophy is very simple. I like to treat others the way that I would expect to be treated myself. I mean, it's an honor to take care of someone. People don't ask to be sick. People don't ask to say, I think I'm just going to go see a doctor for no reason. There's something that's really important to that patient, and that's the reason that they're there to see me. And it's the ability to make a relationship. It's providing options, providing empowerment, allowing patients to choose, and sharing in that decision process with the patients. Common conditions that I would see include chronic obstructive pulmonary disease, asthma, sarcoidosis, interstitial lung disease, obstructive sleep apnea, chronic bronchitis. I have a strong background in the oncology space and taking care of unfortunate people with cancer. And a lot of times patients with cancer, they view their records or they read reports and they have questions about what does this finding mean on this report. And I feel that it's up to me, particularly as it relates to their lungs and their treatment, to explain it and to show it. It's not about me as the physician, it's about the patient that's in front of me. You can very easily feel the next day the effects of poor sleep or disturbed sleep. So imagine having to live that life every day without having any control over it. So sleep apnea is one of the most common sleep disorders that I've treated, that I continue to treat. Very passionate about it since I've had a lot of personal close exposure in my family as well as friends living with it. And I know firsthand the difference that it makes when it's treated. And as a specialist, it's my duty, my obligation. It's why patients come to see me, to know what is available, what are the latest, the greatest, what are the pros and the cons of doing something versus doing an alternative treatment that may improve the quality of their life and their condition. I mean, if you think about it, how is COVID spread? It's spread through droplets, through the lungs. Essentially, it's got to come into your body. It gets into your body. We breathe it in, into the lungs. It gets exhaled into the air. So it's impacted pulmonary in a large way, from diagnostics, from timing of procedures, timing of diagnoses, timing of treatments. I am committed to uncovering any options for somebody lingering with COVID symptoms, to provide options for treatment and to make those symptoms better and to continue to follow them over time. I came to Inspira because of the doctors that are at Inspira. Whether it's oncology, surgery, primary care, all the resources that a patient would need are right here within this network. I mean, it's hard to not notice the impact that Inspira is making on the community. I live in this community. I'm proud of my community. I'm proud to be a member of this network. It's important to me to be able to walk the talk. So if I am with my mother when she's talking to her doctor, it's important for me to realize that when someone else is with their mother, that I give to my patient and their family what I would expect. But I look at this as the beginning of a long-standing relationship whenever someone comes to see me. I like to get to know my patients, their family, their loved ones, and I like to be involved and empower them over their care.